Assalamu alaikum guys, welcome back. Preseptal cellulitis or periorbital cellulitis versus orbital cellulitis. The orbital cavity is lined by a tissue, a septum, that is known as orbital septum, and if the infection lies anterior to this, it is known as preseptal cellulitis, and if it goes posterior to this, it is known as orbital cellulitis. Now, preseptal cellulitis, the causative organisms are usually Staph aureus and Streptococcus pyogenes. Now, it can enter either due to a trauma, an insect bite, or any other laceration, somehow any way for the organism to enter the cavity that can cause the infection. But preseptal cellulitis is usually less dangerous or less harmful than orbital cellulitis. In preseptal cellulitis, there will be no pain, there will be no ophthalmoplegia, that means his extraocular movements will be fine, his vision will be fine, the pupillary responses will be fine, but he will have swelling, erythema, and there will be no proptosis as well, no chemosis, no proptosis. So if these patients present to you, but you need to be careful, you need to start them on medicines, antibiotics as soon as possible, because that can convert to orbital cellulitis. So the treatment for this is amoxicillin and clavulanic acid, and if we talk about an adult, then the dose is 1 gram BD, that means twice a day for 1 to 2 weeks, and no hospital admission is required in this case. Now if you come to orbital cellulitis, now that the infection has invaded or it has gone posterior to the orbital septum. Now in this one, patient will have proptosis, that means the protrusion of the eyeball to some extent, there will be ophthalmoplegia, limited eye movements or pain with extraocular movements, his visual acuity will be affected, his color vision will be affected, the pupillary reaction to light will also be affected, and fever will be present in both of the cases. Now again, the cause of orbital cellulitis, it can either be trauma or it can be due to a sinusitis, sinus infection. Usually sinus infection should be kept in mind, and patient should undergo CT scan to exclude sinusitis. Or it can be hematogenous spread, that means that the organism have entered the bloodstream from any other side and reached this area. Or it can be due to an insect bite. Now this one is very dangerous. You need to admit the patient as soon as possible he presents to you. The hospital stay is mandatory. You need to start him on IV antibiotics, where in the case of preseptal cellulitis we started him on oral antibiotics, but that can also require IV depending on the condition or the stage at which the patient presents to you. But usually preseptal cellulitis requires oral antibiotics, and this one, orbital cellulitis, requires IV antibiotics. So start with a third generation cephalosporin like ceftriaxone or ceftazidime, and give metronidazole to cover the anaerobic bacteria. And the bacteria usually involved in this one are Staphylococcus aureus, Haemophilus influenzae, Neisseria meningitidis, and Streptococcus pyogenes. Now before starting the antibiotics, send his blood culture, send CBC to check for white blood cell count, and then you can start him on IV antibiotics. Send the patient for CT, higher resolution CT scan, to exclude any abscess, and you can also do MRI in some patients. The reason we are doing this is if there is an abscess, like you can see it in the image here, the abscess, it needs drainage. Now that cannot be treated with IV antibiotic. Or if you suspect an optic nerve compression, severe optic nerve compression, then a canthotomy can be done to relieve the pressure on the optic nerve. So in short, if you want to differentiate between preseptal cellulitis versus orbital cellulitis, in preseptal cellulitis there will be swelling, erythema, and fever, but there will be no pain, no ophthalmoplegia, visual acuity will be fine, color vision will be fine, pupillary reaction to light will be fine, and there will be no proptosis. In orbital cellulitis, you will find all these signs present along with fever, swelling, chemosis, and all that. So guys, if there are any questions regarding this topic, please do comment and I will try to answer them. Until my next video guys, take care.